Hello there, this is your host, D, and this is Uneven. I'm trying that name out. I don't know if I'll stick with it, so whatever name is on this, on your podcast player or YouTube or wherever you're listening to it, that's the one I went with. I'm just trying out a name called Uneven, so we'll see how that works. If I stick to it or not. You know what? It's okay to be sad. That doesn't mean you're depressed. It's okay to be worried. That doesn't mean you're anxious. It's okay to experience trauma. That doesn't mean you have PTSD. Not everything is a diagnosable issue. That was a quote from a podcast that I listened to quite frequently. The guest was Adam Lane Smith, a psychologist or former practicing psychologist, now a relationship coach, who had been working in marital counseling for many, many years. And I think he has a really good point. So many people hide behind a diagnosis and say, I never have to get better. That was another quote. I know this because I'm guilty of this. I sometimes will hide behind my diagnosis, although I try desperately hard not to. It's a struggle I have all the time. I do not want to use my diagnosis as an excuse not to get better. My diagnosis is a term we now use, BIND, which is benzodiazepine-induced neurological dysfunction. Other people might know it as protracted benzo withdrawal, all kinds of different terms that have been used over time. Basically, it means that I took anti-anxiety medications, benzodiazepines, for 12 years. I was on clonazepam for 12 years. Came off the drug over an 18-month period, and I am now 9.5 months benzo-free, but still have neurological dysfunction from it. Neurological damage might be the better term. And the past 9 years was very difficult at times, especially early on. Now, I'm an extreme case. Most people don't have this extreme of a reaction coming off benzodiazepines, but some of us do. Some of us do. So I definitely come at this from a place of bias. And that place meaning we diagnose our issues so we can medicate them. And that isn't always the right answer. Now, I do want to say right here, and I'm going to say right here, that I am not a medical professional, and nothing I ever say should be taken as medical advice. I have no medical background. I cannot diagnose drugs, and you should never adjust any medication based on anything I say here. Please always work with your doctor. If you ever are interested in changing medication, decreasing medication, or anything, please work with a licensed physician. I am not trained in this, nor can I give advice for that. But I can voice my concern. I believe, this is my opinion now, that we over-medicate our society significantly at times. I know some people that I've worked with through my other podcasts that have been on 10 to 15 psychiatric medications at the same time. I can't imagine what it's like thinking if you want to reduce your medication and you work with a doctor to do so, what that's like to try to do that. It's so daunting. I took 18 months and then recovering now for another almost 10 years to come off of one medication, a very potent and strong medication that can have severe consequences. And I've been on a few different research teams since then working on trying to raise awareness and to show the complications that can come from this class of medication. For those who don't know, when I refer to benzodiazepines, I'm referring to medications like Xanax, Ativan, and Valium, and of course Klonopin, the one that I was on. I'm also not against medication or even psychiatric medication per se. I think some have benefit. But I also think we prescribe them quite easily and readily and without really understanding the side effects. There is no such thing as a medication without a side effect. And some have quite severe ones. Some have some long-lasting ones. Some have some permanent ones. If you find yourself on a medication like that, I want to tell you also, there's tons of hope and there's tons of help if it's something you would like to discontinue. And you should seek help from a doctor or from somebody licensed to do so if that's your choice. And if you believe a medication is currently helping you and you wish to stay on them, I'm not trying to talk you to come off them either. I think some medications can help. And you have to look at the pros and cons. If every medication has a side effect, and it comes down to weighing the benefits against the negative consequences of that medication. And as I'm talking to you here, my dog wants to go outside. So I'll be right back. Okay, now that's done. I let my dog out and things are better. I think so. We'll see if he calms down. He's a little anxious this morning. We'll see. You might hear him in the background a little bit here or there. One of the things that they mentioned in this podcast was there's something very reassuring about pathologizing your emotions. And I've noticed myself getting caught in that too, about if I can diagnose what's actually wrong with me, then I can say there's something wrong with me. Or I can say I have this, or I am this, which we do far too often. I am a person with ADHD, or I'm a person with, bipolar, I'm a person with something. But there's a little sense of comfort to say, okay, I have a reason now for why I behave the way I behave. For why my mind works the way it works, for why I get anxious all the time, for why I'm always sad. And it's comforting to think that there's something else causing this, thus it's not my fault. And blame is not a helpful tool, regardless, whether it's blaming others or blaming ourselves. It never really helps anybody. So blaming yourself is not the direction to go, but also maybe finding a diagnosis isn't always the way to go either. In the medical community, diagnoses mean that you have an illness, and illnesses need to be treated. And with psychological illnesses, the most common forms are counseling and medication. Those are the most common forms of treatment. And there are many people who will argue that the psychiatric profession is built on medicating these issues. And there's some truth in that. If you look into the research and you look at the history and you see what's been going on, there's some things that don't look right. But I'm not about to damn one profession or other. I don't believe that, and I believe there's a lot of really good practitioners all around. But I do believe we over-prescribe, especially in the psychological spectrum. That's my opinion. As being a person whose life has been severely affected by that. Yeah, I have seen that, and since then I've researched and seen it. But there is that comfort. My question and my point here is how we so much want to connect to that diagnosis. We want that reason for why things are going bad. And if we take a medication for it, now we understand. But we also have a tendency to medicate normal behaviors or just slight aberrations from normal behaviors. And we over-medicate it. We throw pills at everything because, Johnny won't sit quietly in the classroom, so he must have ADHD, and we must medicate him. The standard medications for ADHD are stimulants. These are medications and drugs that have addictive tendencies, that have complications, that have been, if you look at the history of stimulants, it's not good. And I'm not saying that these may not be helpful for people with ADHD. But I can tell you quite often we have medicated people, especially young boys who won't sit still in a classroom. we have over-medicated them just because they're not sitting quietly and listening. That's my phone. I guess it got charged. Now it's making more noise. Not sure what's going on there. Anyway, would you stop doing that? The irritations of life that get in your way while you're creating some incredibly profound podcast episode, which it isn't, and I know that. I mention ADHD in part because I was diagnosed with ADHD, but not as a child. I was diagnosed as moderate to severe ADHD in my 50s. And one of the options, of course, was to go get medication, which was recommended to me. I didn't pursue that. I had just come off of benzodiazepines, so the last thing I wanted to do was to take on another medication, and I'm really glad I haven't. Now I have people in my life, and I think many of you have experienced this, especially those of you who have come off benzos and other drugs like that, of people around me saying, oh, well, Sam took ADHD meds and he's doing so much better. And so did my cousin Ralph, and your brother-in-law, Phil, and I'm making up these names, also took ADHD, and his life is so much better now. And perhaps that's true, and I'm really happy for them. I come from a place of not against medication, but there better be a really good reason that I need it if I'm going to take medication. After what's happened to me, I have a good reason to believe that way. But even still, I do believe we over-medicate things in our lives as a whole. Maybe I'm right, maybe I'm wrong, but that's my belief system. But I do think we, as people who struggle with, I don't even want to say mental health, because even that starts to diagnose us, but struggle with our minds, okay? Whether it's worrying and, which we call anxiety, which anxiety is normal. So, first of all, if you say you have anxiety, that's not saying much, because anxiety, everybody has anxiety. If you say you're depressed, trust me, everybody's probably been depressed at some point. But there are clinical places that people go to that are extreme, and maybe at times they need to be medicated. But I lean on the side of, if there's a way I can try to deal with it myself and try to improve my life more naturally, I'm going to pursue that first and try to stay clear of the side effects that medication bring with it. Maybe that's for you, maybe it's not. But that's where I come from with that. And since I am ADHD, according to the test, and maybe I'm not, maybe I do believe ADHD is overdiagnosed. It's a common thing. Like I said, if a kid won't sit still in a classroom, we're going to call them ADHD, toss medication at them, and now you have a calm child who's easier to teach. But we really don't know the possible damage that may have done to a whole generation of children. We really don't know. Here's one of the interesting things that I've learned from being on several research teams. I've been on maybe 4 or 5 different research teams, and one of the research teams we've done a few studies. I probably have 6 maybe now papers with my name on them as an author, which if you're in research you realize that's a very low number. But for somebody who doesn't come from the research world, from a layperson world, it's like, I'm just amazed that I ever was included on these research teams. But I've learned things by doing that and by being involved in that world. And that is this. We almost never know the long-term ramifications of a medication. And if you don't believe me, just think about it. How would you identify the long-term ramifications of a new medication? Pfizer or Lilly or whoever, I'm not picking on a company here, I'm just throwing out names randomly. But say ABC Corp, okay, I'm making one up here, comes out with a new medication to treat Alzheimer's, okay, whatever. And they put it out forward, they've tested it, they've, which is a whole other thing, but they've tested it here or there enough to get it up to FDA. FDA approves it, okay? And they come out and say it's safe. And this is where I have the issue. How can they know this medication is safe? It is not possible for them to have tested long-term effects of this medication. These studies take 10, 20, 30 years sometimes to do when you really want to look at a long-term effect. Benzodiazepines is the perfect example. Nobody's ever done a long-term study of benzodiazepines from start to finish. Now, we've done some studies that have looked at people that have been on the medication and come off it and what their, effects are. But we don't know when they start. I mean, we didn't start tracking records from the beginning. We didn't follow them through. And those studies were not available when these drugs first came out because they couldn't have. So I'm kind of jumping around here. What I'm saying is a study of long-term effects of any medication takes time and a lot of money. They can take 10, 20, 30 years to do a good study of the long-term effects of a medication. That can't be done. It's just not feasible. So when they come out and say this drug is safe, they're talking about usually side effects during use or maybe immediately after stop taking the drug on occasion. With benzodiazepines, some of the most significant effects have shown up 6 months, 12 months, 18 months, 5 years later for some people. That was never tested. And honestly, when pharmaceutical companies do the testing, they can sometimes pick the tests they want to use to get FDA approval. I don't think the process is great. I'm not trying to come down hard on pharmaceuticals, although I can't say I'm a big fan of some of their practices. I'm not trying to come down hard on doctors. I think most medical professionals are trying to do good by their patients. I really believe that. Maybe not all, but I think most are. But is there a problem with the system? Is there a problem with overprescribing? Yeah, I believe there is. But all this comes back to the point of identifying what we have and wanting to label it. I have GAD, general anxiety disorder, or I have, bipolar, or I have post-traumatic stress disorder, or we want to say those labels because those labels are tied to being recognized as having an issue. Sometimes it's tied to getting a disability check. Sometimes it's tied to being, getting disability discharged from the military. Sometimes it's tied to people understanding what you're going through and acceptance. I come from a world where nobody really knew about what I was going through. There was this community online, and I found them, and I learned from them, and now I help them. But in the general public, people don't know what benzodiazepine withdrawal is. They just don't know. I don't have that label. I have an antsy dog walking around here in the bedroom with me, but I don't have that label. And my point of all this is that we have to be responsible for our own health. And on the medical side and physical side, it is equally as important on the psychological side. We are the only ones that really can make a difference if you want to. I don't want to just lay around the house all day and say I have bind, the benzodiazepine effects of what I went through, along with, long COVID and ADHD and all these other things that I've been diagnosed with, I don't want to just lay around and say, that's why I don't do anything. That's not the way I want to live. And that's not what this podcast is about. We're about saying, okay, I accept that I have limitations. I accept that I've been affected by things in our life. I accept that, life isn't fair and some bad things have happened to me. Now, what am I going to do with that? How am I going to make the best life with those limitations, with the effects of that, with my severe anxiety, with my ADHD, if that's really what I have? Which I think I do, because it makes a lot of sense for me. This is how I've been my whole life. But it doesn't mean I needed to be medicated necessarily. And I'm glad I wasn't diagnosed as a child. We didn't diagnose ADHD when I was a child. And I'm glad I wasn't medicated, to be honest, because guess what? I learned to adapt to it. Was it a problem? Was it difficult at times in my life? Yeah. As I look back, it was. But I developed skills to work around it, to manage it, and to become a relatively healthy and, I think, a pretty decent person. Be careful of falling into the pit of saying, I am. That's a tough one. I am a person with bipolar. I am a person with ADHD. I am a person with bind. I am a person with PTSD. I am a person with severe anxiety, and letting that own you. Because it can own you, and it's owned me in the past. Don't let that happen. This is just a part of you. It's a part of you. Everybody out there, everybody has things in their life that create limitations and that affect them in a negative way. You can't live this life without having trauma, without having some mental illness diagnosed probably at some point. I don't know. I'm not saying we've all been diagnosed mental illness. I'm not saying that at all, but I'm saying we've all struggled psychologically at some point. Everybody's been sad. Everybody's been a little depressed at times, I bet. Everybody's been anxious at times. We have to. We wouldn't survive if we didn't have some anxiety. Everybody's had their heart broken. Everybody's been lonely. We've all struggled. We've all struggled. The question is, what are we going to do to make our life better? What are we going to do to be a better friend, spouse, parent, child to those around us? What are we going to do to head towards that career you've always wanted, or to do better in the career you've chosen, or to find that job that's different, that really is going to feed your soul or whatever you want? What are you going to do to be able to take that trip to Australia you've always dreamed of? How are you going to get there? What steps are you going to take to make sure that when you do that, you can enjoy it, you can be in that moment? To me, that's what life's about. Accepting where you're at, not using where you're at as excuses, although we all do now and then, but trying not to let that happen. And instead saying, okay, this is where I'm at. Now, how am I going to get here? I'll talk to you later.
Hey, this is Dee. Thank you so much for stopping by and checking out our podcast. I do need to remind everyone that this podcast is for informational purposes only and should never be considered medical, psychological, or professional health advice of any kind. If you or someone you know is dealing with significant mental health issues, please seek professional help. Resources can be found in our show notes and on our website at unevenpodcast.com. Take care of yourself. and I'll catch you on the flip side.